Like I said, it's 2 o'clock. There it goes. It's 2 o'clock. Let's go ahead and get started. Welcome to the Quality Connection. As you can see, today we will have the fabulous Kimberly Webster reviewing the NC HIE. So before we hand it over to Kim, I do want to remind you all that we are asking that you don't record these sessions. We do record them. I found that note taker. There it is. We do send these recordings out weekly with our follow-up newsletter. If you're not receiving those, excuse me, feel free to drop your name and email address in the chat. I can definitely get you added to the list to receive the follow-up information. And without further ado, Kim, I know you are ready to roll. You are free to share your screen and educate the masses on the fabulous NCHIE.
Well, thank you, Crystal. Thank you. I appreciate it. Man, it really does. And thank y'all for joining. I appreciate you taking your time. I know how busy it can be doing patient care, but it really is a helpful and useful tool. And that's why Crystal wanted me to talk to you all about it so that you would know that this is a thing that you have access to, so that hopefully you wouldn't have to have 5 logins. You could just go to the one place. So my name is Kim Webster. My background is clinical. I'm not a tech person. I'm a nurse. Have been since 2004, and I maintain my license. I've been here with the HIEA since 2022, and with that, I'll kind of talk to you guys just briefly and quickly about what NC Health Connects and the HIEA is, and then probably get a little bit more into actually showing you the portal because that's where the actual stuff is that can help you in your patient care. So this is what we're going to cover. What is the HIEA? What does the law mandate and what services do we offer? And then go over any questions that you all may have. And if any of you have questions while I'm presenting, by all means, come off mute or drop it in the chat. I do not mind that. So just kind of in general, I'll explain what a health information exchange is. And just so you all are aware, and I think because a lot of people are shocked because as healthcare workers, we are kind of beat over the head with HIPAA, right, and privacy. And whenever we find out that there are literally these health information exchanges everywhere, all over the country, there's, dozens, if not hundreds, we're kind of shocked, right? Because we're like, what? We're sharing information. But, that's the portability part of that HIPAA act is being able to share that information and carry it with you when you go see different providers in different places. And also, all of this kind of came from the 21st Century's Cures Act, which I think was in 2014 or 2013, somewhere around there. But that was a federal act that said, you're supposed to share information. And if you don't, you can get in trouble for information blocking. I think now with TEFCA, we're starting to hear about information blocking. But I just like to kind of step back because I get it, right? We're all beat over the head about HIPAA and privacy. And so it's kind of shocking to know that, wait, that you guys share information. But the whole point and purpose of that is that you, as the provider, can access that information for patient care. So a health information exchange means that no matter where that patient's seen in the state, right, if they go to get radiology or labs or they go to the hospital or urgent care, that information flows into that health information exchange and it's there in that central data repository for you all as providers to access for patient care, right? If they've been in the hospital, if they're on Medicare, Medicaid, you got to do those hospital follow-ups. Well, how do you do that if you don't know they were in the hospital or you don't know what they did in the hospital? So having the notification that they went and B, the note from the visit helps you to do that follow-up care. So the North Carolina Health Information Exchange Authority, that is the state agency that who I work for. That is who oversees the state designated health information exchange known as NC Health Connects. What our comms person likes to tell folks, and I think it's a good way to kind of separate it, is that the HIEA is the agency and NC Health Connects is the product, right? Is the actual health information exchange. We're part of the North Carolina Department of Information Technology, like that is where we are housed. And our technology partner is SAS Institute and Cary. So they're the ones who handle all the technical aspects. So if you ever have to, reset a password or you need to request access for your staff members, you would actually be emailing the HIE support at SAS. That's the place where you'd email. We have an advisory board. It's got 12 members. It's made up of various healthcare representatives, folks from the large health systems in the state, and then also the DHHS secretary, DIT secretary, and GDIT director. And the whole point and purpose of the Health Information Exchange is so that, like I said, that you guys can access that information for care so that you're not having to fill out all these release of information and faxing and phoning and trying to get the records that you need to be able to care for patients. And these are just some of the benefits of a health information exchange. And there's actually been a lot of studies that show that participating and utilizing a health information exchange improve patient outcomes. And that's because you get a more complete picture of a person's health that helps reduce, staff time, phoning and faxing, but also the patient's time because they may be waiting for you to get those results for you to make a treatment decision. Access to the health events as they happen with those notifications that we talked about, improved, more accurate and timely medication reconciliation, because again, if you can see that record and know what was prescribed, and I'll give you a real world example. My previous job before I worked here, I worked in physical medicine and rehab, and I would have so many patients come in that were on gabapentin and Lyrica, and I'm like, well, why are you taking both? And it's because, well, the neurologist or the pain doctor gave me this one and my regular doctor gave me this one because one didn't know the other one had prescribed that other drug. So it's just important to know that information. And there is a mandate in the state of North Carolina, and we do like to talk about that because North Carolina is kind of unique, which is both a blessing and a curse, right? Because it means we have to pave our own way. There are, I don't know of any other states that have a mandate. There are about a handful of states that have a state-run health information exchange. All the rest, I think there's maybe 6 states. All the rest are either profit or not-for-profit private organizations. So they're selling a product. But in North Carolina, we actually have a law, and that is the Statewide Health Information Exchange Act. And that says that certain providers who receive state funds, so the North Carolina State Health Plan for teachers and state employees, North Carolina Medicaid, and certain state funded grants, they have to submit that healthcare information to us since they're receiving those funds. And there are certain providers that are voluntary. So, for an example, home health nursing is voluntary, but skilled nursing facilities are not. They're mandatory. OTPT is voluntary. Eye providers are voluntary. But we have a lot of home health agencies that still sign participation agreements with us because they need access to those records for their treatment plans. Um, and there was a deadline in 2023. Basically, the only thing you have to do to meet the mandate and be considered, making a good faith effort is you have to have submitted a participation agreement, and you have to, if we reach out to you and say we're ready to connect you, you have to work with us, right? This is an example of the data target that we are collecting from medical providers. So you can see here in the dark blue, that's the patient information. The green, the encounter information is in the green, and then the actual clinical information is in the blue. And if you want more details, you can click on this link right here, and it'll take you to our onboarding packet and technical specifications. And the reason I say this is because it's literally got a chart of every single field, data field, and it'll say if it's uh, required, in other words, you have to send it to us, or required if collected, meaning if you collect that, you send it to us. And we always like to contrast this to the behavioral health data. So we do not accept 42 CFR Part 2 data, which is substance use disorder treatment data, and we do not accept psychotherapy notes. That does not mean that behavioral health providers don't have to connect. They do. They are a mandatory provider, so that means they have to connect. But what we receive from them is very limited data, as you can see here on this slide. So we're getting the patient's information, the visit information, and the diagnosis. So if I were to go see a therapist today at 2:30 for anxiety, it would say Kim Webster went on 6/24 at 14:30 to see, Jane Smith, LCSW for anxiety. And that's what we would get on that visit. So since there were changes to HIPAA 2 years ago, I think, saying that you can now share Part 2 data and psychotherapy notes, but it has to be with patient consent. So if you have patient consent, you could send that information via direct secure messaging because it's a secure encrypted messaging system, but you have to have patient consent. And the reason for that is because of the way North Carolina is set up. North Carolina is an opt-out state, so we're all opted in, and I'll kind of talk a little bit more about that in a couple of slides. This is just talking about our privacy and security. So we're on the same side of HIPAA as you all are as providers, meaning that this is not just like open to anybody, right? You have to have a participation agreement with us, and to be able to access that patient data, you have to have that full participation agreement because it includes the business associate agreement, which is required by HIPAA to be able to access patient information. So we are on the same side of HIPAA as you all are. So obviously we take, privacy and security very seriously because I don't want to pay $10,000 and I don't want to go to jail, right? Um, we also use user access, so role-based access to control who has access to the data. So for example, for you all, your participant account administrator, that's our person that we contact, right? And they are the person that decides who gets what access. So if you need to access patient information for your job, that is what we call a clinician role. You do not have to be a clinician, right? It is not dependent on the initials behind your name. And the reason it was set up that way is because there are a lot of small practices in this state where it is literally one provider in the back seeing patients and one person in the front checking them in. And so if that's the case, that person in the front, even if they're not a CMA or a nurse, um, they may need to have that clinician access so they can look up stuff for that provider that's in the back. So the participant account administrator for that organization decides who gets what access. So the main two, there's a lot of different roles, but the main two is clinician, meaning you need to be able to see the clinical data for a patient, or clerical, meaning that you just need to see demographic information and not actually any of the clinical information. And then this is just a list of our policies. Again, you can always click on these for more information. Uh, the opt-out. I said a few slides ago that North Carolina is an opt-out state, and that's kind of counterintuitive. So basically what it means is all of us, everybody, is opted in unless we opt out. And to opt out, currently the process is a patient has to fill out a opt-out form on our website, print it off, mail it in, and then we have to process that form. The whole thing can take 2 weeks. Sometimes it takes 2 weeks for us to get the form. We are working on an online option that would be much easier for patients because I don't know about you all, but I don't know many of the folks that I have taken care of, or even my friends and family, that have a printer and envelope stamps. So that's kind of a big ask to ask people to mail something in. So we are working on trying to get an online option. It's just that because, we're a state agency, it has to, everything has to be secure and all the boxes have to be checked to have something on the web form. And because of that, we kind of say if the providers want to print that out for the patient and mail it in, by all means, you can do that. That's up to you all. And this is just talking about basically how it works. There's nothing that you have to do to send us that data. You just simply document, you see your patient and document like you normally would, and your EHR vendor is the one who sends us that information. And if you have a full participation agreement, same thing. You document just like normal. Your EHR vendor sends that information, but then you can also access that information through the clinical portal. And I'll just talk about our suite services, and then I'll show you guys the portal. And if you guys have questions or something specific you want to see, let me know. So this is all of our services, which is a lot. The exchange is the portal. NC Notify, that's our event notification service. We have a pass-through to the controlled substance reporting system so that you don't have to leave the system. We also have public health reporting with a diabetes registry and a stroke registry. We offer direct secure messaging. So basically that's a secure encrypted email. I'll talk a little bit more about that in a couple slides. Obviously data quality and then training. NC Notify is our event notification service. So basically, if your patient gets seen anywhere outside of your organization, we send you a notification that says, hey, your patient went to radiology, or hey, your patient went to the hospital. We send those notifications and we send them in near real time. We don't charge for this service. And I think that's probably the main draw. Since we're a state agency, we don't charge anything for any of our services. I know there are other ADT alert services that do charge, and a lot of the ACOs actually subscribe to NC Notify and then kind of disseminate that information out to the providers. But it just lets you know that your patients received care outside of your organization. So it helps with if you have Medicare or Medicaid patients that you have to do those hospital follow-ups, that transitional care management or tailored care management. It's pretty much a requirement so that you know that they were admitted to the hospital so you can follow up. It also helps, do the follow-up for medications, helps meet value-based care contracts. And there's a couple of different ways you can do it. You can send us a panel and say these are the patients we want notifications on, or you can do what we call auto attribution, which is as you see a patient and you send data to our system goes, oh, that's your patient. I'll send you notifications on them. Direct secure messaging, this is what I was talking about, to be able to send messages to providers. Again, there are a lot of small practices in the state and their EHR vendor doesn't have an inbox or a messages box. And if you don't, then we can provide that service for you. We don't charge anything, and you are able to look up providers in the system. So if you're a care manager and you have to send care plans, you can do that via direct secure messaging because you can send it as an attachment. If you are, a therapist and you've been seeing a patient, but they need an increase on their antidepressant their primary care doctor's been prescribing. You could message that primary care doctor and say, hey, I've been seeing so and so. They've been on this antidepressant for 2 months. I don't think it's working. Can you either increase it or change meds? It's really important for providers to be able to message other providers. And when you message this provider, let's say that it's a doctor at Duke, and so they have Epic, and Epic absolutely has inboxes, right? When you message from our system, it's going to go to that doctor's inbox in Epic. So I think that's helpful to know, as just a tool that providers can use. And then, of course, we offer training modules. So if you wanted to learn how to use the system, we'd be happy to show you how to do that, either via a live training, here, or with training modules that you could do on your own time. And then twice a year, we have what we call the teletown hall or the office hours. So office hours is just what it sounds like. You can drop in and ask a question, and we have people on the call to help answer those questions. The teletown hall is usually a little more focused on specific, updates with NC Health Connects or how to use certain services, that kind of thing. And I will stop that PowerPoint and I'm going to show you guys what the portal looks like and how to get to it. So this is our main web page, and the clinical portal login is right here. So if you go to our web page, and you can literally just Google NC Health Connects or NCHIEA, but you go here to this clinical portal login, and it'll take you, and it actually has the URL here so that you could, save it for future use. I'm going to drop this in the chat so you guys will have access to it. But anything of note will be up here in this blue box. Like if there's any kind of downtime, like you see here, it says the NC notifies having scheduled maintenance on the 24th. And you want to make sure that this domain, unless you've got an Athena login, is set to HS default. Athena folks usually have single sign-on where they can just go straight into the system and don't have to actually go into the portal. But you want to make sure that this is set to HS default. All the static information's kind of here on the right. And then all of the HIPAA stuff is down here on the bottom, right? That I'm not going to share my user ID or password. And the reason you shouldn't do that with anything is because if someone looks somebody up under your user ID and password, you're going to be the one to get in trouble. If you looked up somebody you shouldn't have looked up. And this is saying, that what I said about HIPAA, that this information can only be used for HIPAA-approved purposes, which is treatment, payment, and healthcare operations. And just to know that this information is monitored, and that, if there's any breach that you will let us know. And if you have, sometimes when you click this button, you'll get this little internal error. I've actually had people email and call about this. If you just close it out and just refresh your page, you should be okay. And if you ever get locked out, you can do this forgot password, or always call the help desk because I'm gonna tell you, you see mine is saved and sometimes I still get locked out and I have to call and be like, can you reset me? And they're very kind and they will do it. This little disclaimer just lets you know that we do not accept 42 CFR Part 2 data, which, we've already talked about, or psychotherapy notes. If you disagree, it takes you back out to the login screen. If you agree, it'll take you on through. And this is the patient search screen, and you may not see this. You may just see a blank white screen that says welcome. And you may not see all these little icons on the left either. This is because it's a demo environment, so set up for everything. Only the participant account administrators will have this PAA tools. And basically this is where they can go in once a quarter. They have to go in and look at this list to make sure it's correct, make sure everybody has the right access that they need and that there's no excessive break the seals. This is what I was talking about, the different roles. Like you can see here that, there's multiple different roles, and they can add or remove users here. This is the patient search screen. And I'll show you that in a minute. I want to show you the messages real quick. This is the DSM. So if you have DSM set up, when you click on this, this is what you're going to see. If you don't, it's going to say something like you don't have access to this. You had DSM and you needed to, and all that takes is a request to the help desk to say, hey, we'd like to set up DSM. But I will forewarn you, if you do that, they do have to verify your identity, that you are who you say you are. And so they do that through, I think, Equifax, not the credit check people. It is, but it's not. It's a different branch. But these are identity verification through Equifax. And they do that by, like, they'll be like, when did you open your Ulta card? Or did you buy, whatever, 2023 vehicle? Like, they ask you those kind of questions just to verify your identity. They're not pulling your credit record. But this is the DSM. If you were looking for, oh, what happened? There we go. If you wanted to send a message to a provider and you needed to find that provider, you literally just click on the to box and you can just search. And there's, I don't even know, tens of thousands of providers in here because we get that directory from the Secure Exchange Solutions. NC Notify, if you have NC Notify, same thing, this is where it'll be at, and this will pull up the dashboard. CSRS, this is Controlled Substance Reporting System. You have to already have a login to be able to access this, and that is the PMP Aware, PDMP, the Prescription Drug Monitoring Program login. I literally used to Google PMP Aware to get it to come up and log in. But if you have a login, you'd be able to log in here. This set default application, this is literally just showing you what comes up when you log in. And so you can see mine is set to patient search. And so with that, I'll show you what the patient records look like. And you always want to search by last name, first name, and date of birth. But I will say, if you have, sometimes patients come in, they got that one piece of paper from the emergency room or the hospital. It'll usually have their MRN, their medical record number. So if you have that, you can search by the medical record number and the hospital. So that is a way that you can search by. I think it's 414. I can't remember. Yep. Well, 4414. Okay, I was close. You can see here, right, that it's given me this record. And just know that when you go in to search for a patient, you're going to see a whole, like multiple rows of people. And that is because of the way the system is set up to search. So for example, if I search for myself, if I search for Kim Webster, I'm not just going to get every single Kim Webster. I'm going to get every Katie Webster, Kelly Webster, Kristen Webster, Keisha Webster, anything that is similar to that name is going to show up. And it's just because it's designed to come up that way in case somebody misentered something and there were two split records. And I say that because I've actually had people call and say, there's two records for this patient. I'm like, yeah, because something happened. Something happened when somebody was entering something at the front desk and it affected it down the road because our system, in order for it to merge the records, it has to be an 80% match, and it does probabilistic and deterministic matching. But that all that just goes to say it has to be a certain percentage, and if it does not meet that threshold, it will split and make two records. But you see here that I I can't do anything, right? I can click on this, but I can't actually go anywhere. And that's because I have to declare a patient relationship. Um, and that just depends on your role, right? So since I'm a nurse, it'd probably be I'm a clinician treating this patient, but if I was a care manager, it'd be care coordination. So it's just based on your role. And you see now that it's blue, it's hyperlinked. I can click on it. And so when you go in, and I'm going to collapse this so we can see. It's going to take you to the clinical summary. Clinical summary is just like basically a snapshot of the patient. It's going to show you the 5 most recent allergies, 5 most recent medications, 5 most recent documents, 5 most recent labs. It's just giving you a snapshot view. Um, to get more information, you just click on the tab and it'll show you more information. So here you can see we've got diagnosis, both current and historical, allergies, and you can click on that to get more information. This is a read-only system, so you cannot screw anything up. I promise you can click to your heart's content and not mess anything up. Medications, and this is searchable, so if you wanted to be able to search for a specific dosage history on a specific drug, you could search and it would take you in there. And same thing, you can click on here to get more information to see when was that drug put in, who put it in, um, did the instructions change. Documents, this is where all your, like if they've gone to the hospital and you're looking for hospital discharge summaries or after visit summaries, that's where this is going to be, is in documents. And you just click on that document, and it's actually the document itself is hyperlinked. So if I just wanted to know what medications were given or changed or whatever during this visit, I could just click on medications. It'll take me to that section of the chart. I will say sometimes things are in different places, and it has to do with where it's mapped at from the provider. I'm going to give you an example. Like let's say that you have a patient that went to both Duke and ECU, and you found the assessment for Duke in the section that says assessment, but you found the assessment for ECU in the place that says HPI. And that just has to do with how, whenever they were setting up the connection, how they mapped the field. So just kind of be aware of that. It has to do with basically how they sent us the data. Immunizations, that's here. That's helpful if you have kiddos, especially if they travel around, because I'll tell you, we are between the eHealth Exchange, which is the Federal Health Information Exchange, and the Patient Centered Data Home, which is through Civitas. If you have a North Carolina zip code and you receive care in another state, when you search for that patient, it gets pulled from those other HIEs, and so that you can view it here. So let's say that I was on vacation in Tennessee, ended up in the hospital. Because I have a North Carolina zip code, my doctor would be able to search, and it would pull information in from the Tennessee Health Information Exchange, and they would be able to see that. Vital signs are here. Lab results, anything abnormal will be in red. Same thing, you can click on it to get more information. All of your imaging will be here under diagnostic studies, and you can click on it to see that narrative note. Procedures, you might see the CPT code or the name of the procedure. Histories, this is where medical, social, family, but we also have health-related social needs or social determinants of health in here. We currently receive those from Duke and UNC, but that is expanding. That's a project that we're working on with Medicaid to actually expand that out and get it for more providers. And that's like, you know how you have to ask folks every so often, like, have you had any food insecurity? Have you had any housing insecurity? That's where all this will be. And it actually lists each time those questions were asked so that you can see if the answers have changed. Encounters, this lets you know if patients had a visit. Appointments, if they have a pending appointment coming up, appointment that's already happened. Cohorts, this is probably more so if they were involved in a clinical trial. We also have, it doesn't show up here, but in the lab environment, there's a claims tab. So if you need to know, like, has somebody, and we have all the Medicaid claims data in there, and we are working on getting the state health plan claims data in there. And the reason that can be helpful is because that will let you know if somebody already, performed a mammogram and filed a claim for it, or, or a PAP or whatever. Demographics, this is their contact information, and next of kin will be here under contacts. And this displays whatever the most recent thing is that we've received. So let's say they had a visit last week. Whatever information they gave them last week, that's what's going to show up here. So it's whatever's the most recent demographic information. Insurance information here, and then again, that CSRS. If you wanted to print something, you go over here to the right to this, I think this is the meatball menu. Yes. Everything's named after food for some reason. Um, but you click on patient reports. And so there's two different ways you can do it. Okay. So if you know that they had an MRI on a certain day and I just want to print that MRI, you would go to this download summary and just go to that, whatever that visit is that you want, and click download. Okay. And it's going to pull it up as a PDF. Well, I think I've got it set to HTML, but you can do it as HTML or PDF. But this is what it's going to look like. Or if you need to like physically print it, because some providers they want a piece of paper in their hand, then you can actually pull up the patient summary. Just make sure that this view as is set to PDF. We also have the pharmacy claims data. I'll show you that after I show you the report. It's going to take a minute for it to come up. There it goes. But let's say you could print this whole thing, but let's say you just wanted to print immunizations. Then you could go here to this search button and type in an immunization, and it'll take you to that page. So then you know that you only need to print, go over here to print, only want to print or download, because you could always do print to PDF if you wanted to download that. And just do the pages that you need for those immunizations.
And
And
Kim, I know
you
you're
know,
still
hit,
rolling. Sorry.
yeah, you're
I
good,
just
Crystal. Go
we
ahead.
look, we hit time at 2:30, so I know some
Oh,
people have to
I'm so
drop.
sorry. I'm so sorry. No, thank you, thank you, thank you. No, thank you for getting me. That was the last thing I had to show everybody. So I'm so sorry, y'all. If y'all have questions, please let me know. Yes. So somebody said if I need to see a A1C, you could search. You can search. So it doesn't. The data has to be populated here for me to be able to search for it. But yes, you could literally just search for it would be hemoglobin, you know, A1C, and it would pull it up. And then you could just print that page. So, oh, thank you, Sarah. Sarah, if you have problems printing, please let me know, because it might be a problem in the system. And I'm going to drop yeah, absolutely, friend. I got you. I'm going to drop my email in the chat and you email me and we will set up some time to share screens. And thank you, Crystal, for keeping me on track.
That's what I'm here for. I mean, and I can hang around. If anybody can hang around, that's great. If you have to drop, that's fine too, because you can get the recording afterward and just catch up on what you missed. But I do want to give those who can stay the opportunity to ask questions. But those who have to drop, I completely understand. So yeah, Kim, I didn't turn my camera
Thank
back
you.
on. You are awesome. I love it when
Oh,
you
thank you,
present.
Crystal. Thank you.
Yes, because I feel every time you present, I think, why don't people use this service? Like it makes no sense. But
A lot of times because they didn't know. Because look, at my old job, I had access. I had no idea. I had no idea until I came to work here, and I'm like, the whole time, I could have just.
made life easier. So, yes,
Yes,
absolutely.
absolutely.
Thank you.
Yeah, thank you. Oh, go ahead, Sarah.
Girl, I use this every single day, and I
Yay.
teach it to all of my clinical staff and all of our front staff. I teach it to everybody that comes on board.
Oh, that's awesome. Thank you, Sarah. Well, yeah, because I mean, instead of having 5 logins, if you just get away with the one.
Well, we have Athena, so luckily it just integrates in, but I am having some issues. So I would love to. I'm actually in the middle of sending you an email right now to see if I can set up a day to talk to you.
Yeah, that'd be perfect. Yeah,
But
because
yeah,
I and
it
I'll
is so helpful. So
good.
helpful. Like I have closed about in the last 5 days, I've closed about 120 gaps using
Wow.
using NC Connects.
That's
That,
Sarah.
ma'am, that's impressive.
Hmm.
That is impressive. like, like, look, I was in ACO and used to get that spreadsheet and it did not have 120, so I'm very impressed.
Girl, I've been rocking on
That's
this. I
very
started on a
impressed.
mammo and I'm going on a deep dive and I'm just knocking them out, 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 out.
That is awesome. That is
Yes,
awesome,
ma'am.
Sarah. Yeah,
Thank
thank
you. I'm
you.
sending you an email right now.
Okay, perfect. Yeah, we'll set up some screen share and see what's going on.
Thank you.
Yeah.
What you got, Sunny? You went back on
Yeah,
mute.
I'm sorry. Yeah, I was going to say that this kind of program also helps because I came from a hospital setting and I work in quality. You know, honestly, because we have to do med recs. We also, I followed a lot of, especially during flu season, looking to see what kind of patients that got flu vaccines. A lot of your elderly do not remember the last time they got a flu vaccine, when they got COVID vaccines, pneumonia. You'll ask them, and if they're able to tell you, they're like, well, I can't tell you the last time I got it. And then whenever you ask them, would you like to get it? Well, I'm kind of scared to get it because I can't remember if I got it or not. So that hurts the hospital. So we could put as refused, and that's okay. It doesn't count against us, but it still keeps that patient from possibly getting a vaccine they could have gotten in the hospital. But also with medications, a lot of providers outside of the hospital would fuss because we discontinue a lot of medications. We don't restart a lot of medications whenever a patient was in the hospital. It's because we didn't know about it. And
Right.
also, we catch a lot of things where people have had multiple providers who have had multiple medications. Also, in our area, we have a lot of opioid usage, and hospitals are really having to crack down on opioid usage. And so, having access to information to their prescriptions that they were getting and anything like that helps us to be able to work with doctors post discharge in case they need to change anything or look at anything, and also that continuity of care. So
Yeah.
from a hospital perspective, that I was just saying, it's fabulous, especially from, like I said, from a vaccine standpoint and medrec standpoint.
No, I think that's a great use case, Sonny, and thank you for bringing that up because
Yeah,
you always think about kids who maybe move around, and it's nice to have the vaccines from other states, but elderly patients, not just elderly patients,
literally.
friend, I don't know when I got my flu vaccine.
Right.
So,
It's helpful for nursing home too, because a lot of times in nursing home you don't get that record back. But also, like you said, especially with our elderly, I know in my area we have a very high number of elderly, and they honestly just they don't know when they got their
they
stuff.
don't
And
know. Yeah,
yeah,
they
so
just know they do what the doctor told them to do.
right. But it
Right.
and just any kind of information that we can all share to each other, it helps us close gaps, not only from a hospital standpoint, but from your standpoint, this standpoint. And just otherwise, you're just getting you're missing a lot of things, but you're also not getting correct data. So
Yeah.
that was just
No,
my thoughts.
no, I appreciate that, Sonny, because like I said, that's something I had not considered. So thank you for that, because that's a great point. I just know I try to stay between September and November, but I
Yeah,
couldn't tell you when.
yeah,
Yeah.
yeah,
All right. Well, if there are no other questions, Kim, I thank you for presenting today. We'll have to do this well
Yeah. Thank you,
again.
Crystal. Yes,
I'm gonna make
absolutely.
sure your contact information is included in the follow-up email. And I just thank you. Thank you so much.
Yeah.
This was
Thank
awesome.
you. I appreciate it. I hope y'all have a wonderful rest of your Wednesday.
Thank you, Kim. You did the
All right.
same. Thank you all for joining. Take care,
Thank
guys.
you. Thanks, everybody. Bye bye.
Bye.